Good morning. I'm Councillor Lucy Hovels, Chair of the Health and Wellbeing Board. This virtual meeting is taking place on Tuesday the 14th of July and is being recorded live to the Council's website and will be available to be viewed for a minimum of 6 months. I would like to give you a warm welcome to members, officers and any members of the public or media who are watching this live feed meeting. Please bear with us as it's very new to us all. Before I start with formal business on the agenda, I would like to cover housekeeping to help the meeting run smoothly as possible. For those participating in the meeting, please remember all participants except myself as Chair must mute their microphone. All participants should blur their background where possible. To speak, use the chat function on the right hand side, type RTS or request to speak. And remember, everyone in the meeting can see these messages. When I invite you to speak, please remember to unmute your microphone. Once invited to speak, please introduce yourself and the name position that you hold, unless you've already done so within the meeting. If you want to answer any questions that's being asked or contribute to any questions, please use Teams to raise your hand. If my connection is lost, Dr. Stuart Finley, the Vice Chair, will take over the meeting until the connection is restored. If you have any issues with the connectivity, try switching off your video and use the auto telephone function. If the connection issues continue, you will have to leave the meeting and rejoin with a better signal. We will now move on to the formal agenda. Item 1, I have apologies for the absences, and I ask Jackie Graham to provide us with any apologies, please.
Thanks, Chair. We have apologies from Julie Gillen, Lynn Hall, Dr. Jonathan Smith, Nicola Bailey, Chris Cunnington-Shaw and Steve White.
We accept those apologies. Move on to item 2, substitute members. Again, I'll ask Jackie, can she provide an update on any substitute members, please?
Thanks, Chair. We have Levi Buckley for Julie Gillen, we have Marie Smith for Lynn Hall and Sharon Cadell for Steve White. Thank you.
Thank you again. Very welcome to this morning's meeting. Going on to item 3, minutes of the meeting held on the 11th of March. Can we agree the minutes, please? Can we formally agree those minutes? Thank you. Are there any matters arising from the minutes? No other matters arising. Takes me on to item 4, any declarations of interest. Do any members of the committee wish to declare any interests? No interest declared. Moves us on to item 5. We have item 5 and item 6, which I'll take together because they're very much connected. I'll take item 5 first. I will leave the questions to the end. It's my pleasure this morning to introduce Terry Collins, the Chief Executive of Durham County Council, who will provide an introduction before handing over to Amanda Healy, Public Director of Public Health, and who will take us through a presentation. So I'll hand over to Terry Collins, please.
Thanks, Chair, and good morning, everybody. And also welcome to Sharon. I think it's Sharon's first meeting, Chair, so I think welcome to her to the Council and to the County. Chair, I'd like to just start by offering my condolences to all of the families, partners and friends who've lost their loved ones during COVID. It's been a very difficult time and so on behalf of the Council, offer our condolences. Chair, it would be remiss of me as well if I didn't use this opportunity just to thank all County Durham partners for their tremendous work during the emergency. These include the CCG, the Foundation Trust, the Police Service, the Fire Service, the members of the LRF who have been meeting regularly to discuss the emergency, including the military, our university, the colleges throughout the county, schools, the third sector, and most importantly, the people of County Durham who have been absolutely fantastic throughout the emergency, offering their support and help. And indeed, the councillors, and I'm aware other services have received many messages of support and thanks for their work. So There's many other partners who've been involved, Chair, but I would like to thank all the partners and everybody in the county who've worked so hard to support everybody during the emergency. Chair, I'd just like to say that I think it's it's interesting agenda that we've got this morning with the local outbreak control plan. I do think that there is a high possibility that there'll be an outbreak in County Durham at some point. Pleased to say that I'm aware that at the moment the infection rates and the are generally quite low, and there is no risk as we speak. I was at a meeting last night when we're looking at the whole of the region, and as I say, most areas and all areas, in fact, in the region, northeast region, are quite low. But we're aware that as this matter progresses, as the disease progresses, that we're likely to face problems, and therefore it's essential that we prepare. We need to plan. We need to be ready so that we can react if we have any issues going forward. So, on behalf of the partners, I'm absolutely sure with the experiences that I've had, not only during COVID but before COVID, there's such a fantastic, positive working relationship between all of the partners in the county that I'm absolutely sure that we'll work together effectively to ensure that we're doing our absolute best for the people of the county. But, Chair, I would also like to ask government to do the same. I think it's essential that we have all the tools available to us to enable us to manage outbreaks if they occur. And that includes obviously ensuring that there are efficient testing facilities available within our county when needed, and also that we're provided with the relevant data to enable us to make the appropriate decisions to react to any outbreaks. And I'm aware, Chair, that unfortunately there have been problems with both the testing in the past and more recently the data. That has been a little bit slow to arrive to us, and therefore we haven't been able to take the action more recently that we perhaps might need to. So as I say, I'm sure that we'll work effectively together. We're aware that the data and the testing is improving, and I hope that does improve, because I think it's absolutely essential that, as I say, we have all the tools available to us to actually deal with outbreaks as they arise, and then I'm aware that we'll all work effectively together to manage this. So I'd like to pay tribute, in addition to our partners, to Amanda and the team for the work that they've undertaken in producing the plan. You can see it's a very comprehensive plan, and I'm sure that this is something that will stand us in good stead during the rest of the year and beyond, as we continue to manage the emergency that we're all facing. So without further ado, Chair, I'd like to pass on to Amanda, who will actually talk through the local outbreak control plan. Thank you very much.
Thank you, Terry, and obviously the committee endorsed the words that you've said, and all of the work that does take place with the council and our partners is very important, and we work in partnership. And I think that's been our strength all the way through this COVID-19, that strong partnership, honesty with each other, and taking the work forward. So we make sure with that we minute the comments that you've made, Terry, within the minutes, and I'll go straight on with item 6, which is the local outbreak control plan, and ask Amanda Healy, the Director of Public Health, to deliver the presentation. And at this moment in time, I'd like to thank Sean Barry, who's going to help with this presentation.
Thank you, Chair. Thank you. Good morning, everyone. And I just want to say thank you to Sean, who's a public health practitioner, who's going to load the presentation for us. I thought would save going through every page of the plan this morning and summarise the plan in the presentation. But before I start to go through the detail of the local outbreak control plan, I suppose want to take you back to, obviously, at the end of January, our last Health and Wellbeing Board, we did have our health protection assurance report, and our consultant in public health for County Durham, Deb Wilson, gave us an update at that point, along with partners around the room, health partners and social care partners, about what we were already doing at that point in relation to the pandemic. And obviously a huge amount of work has taken place from that time right through to this point, where we are now starting to work on outbreaks at a local and at a North East level. Obviously, as Terry's already said, we have seen deaths across County Durham, and every single death is a very, very sad death for the person and for their family. And really where we are at now is trying to ensure that we can prevent the spread and onward transmission of COVID. And that prevention is and remains really, really key to the local outbreak plan. We know now that restrictions are lifting as well, that we are starting to see, we'll see an increase in people going about their everyday lives with some mitigations to social distancing and potential of masks in different settings. But we really want to enable us to keep our population and our local residents safe. And that's part of the purpose of the plan. We were asked to produce the plan at the very beginning of June, and it had to be published by the end of June. And I'll go through in the presentation the governance arrangements, but it was a very, very rapid turnaround. I think because we already had Health Protection Assurance Group reporting into the Health and Wellbeing Board, we were able as a group of partners to move very quickly to get this local outbreak control plan, not just written down on the page, but actually enabling us to work collectively in readiness for any outbreaks. Thank you, Sean. Obviously, in terms of the purpose of the outbreak plan is really to think about at this point responding to COVID-19, both in terms of cases and in particular settings and population groups, and managing the potential interruptions to either businesses, schools and in certain settings, and to stop that onward transmission. And we've had lots of questions through the development of the local outbreak plan, and they will continue. And that's our role, I guess, as both as the board members, to really think about what do we do in a certain situation, how do we respond, how do we ensure we're ready, and how do we cope if we have an outbreak of COVID-19. I think as well, just to say, in terms of an outbreak, what we are looking at, or the definition is 2 or more cases that have got some association within 14 days of one another. And linking back to the data, that is really important, because at the moment we are not able to fully link every single case that we have, and we really need that data down to absolute employer, place of employment, school, person, so we can absolutely ensure that we can rapidly detect cases, help people to self-isolate and stop that onward transmission. Thank you, Sean. So the purpose of the local outbreak control plan, and there was some guidance nationally in relation to this, but we've really obviously focused on what we want to do locally as well. So our overriding responsibility is to protect the health of our local communities. And that's to ensure we've got very clear prevention and engagement messages in relation to COVID, rapid detection of any outbreaks, so we can be on top of those outbreaks very, very quickly. Controlling that onward transmission, so that would be, and depending on the setting, in relation to cleaning, infection prevention control measures, obviously supporting people if they have symptoms to be able to self-isolate and self-isolate for the correct amount of time, so they're not obviously infecting other people. And providing support to those people who have self-isolated, and building on the population health management approach that we've taken to the pandemic. And obviously, we've had the development of the County Durham Together, the community hub, with really, really strong links to health partners, to our community and voluntary sector. And we want to continue doing that for people who would need to self-isolate. And really using the intelligence that we have and the knowledge and insight from our local communities. This next phase of the pandemic will require us all to be very vigilant, and if we have concerns, if we know of places where we think there might be cases of COVID, to let us know through the Health Protection Assurance Group, and as well as the information that we get through from Public Health England. Thank you, Sean. So the local outbreak control plan, and really our communities are at the centre of it. What we've found is that nationally a national joint biosecurity centre has been established, and that has also set up the Test and Trace service, which began on the 28th of May, which I will come back to in terms of how that's working and how that aligns to our local health protection team that we work with on any kind of outbreak or communicable disease. What we see on this plan is that the local outbreak control plan has several themes. It's underpinned particularly by our wellbeing principles and our approach to wellbeing. So it's really about working with our communities, not doing to them, and it will rely on our communities supporting and adhering to the guidance that we have. And we know that there's huge amounts of guidance comes out from government on a daily basis, and really thinking about how we control any outbreaks. I'll go through each of these in a little bit more detail. So Sean, you can pass on to the next slide if that's okay. In relation to the local outbreak control plan, it was asked to put dedicated kind of assurance mechanisms in place and a member-led engagement board, and it felt very appropriate that obviously our local health and wellbeing board, chaired by Councillor Hovels, and having the elected members and cabinet members as part of the board, with a wide range of all of our local partners, that felt that it was the right place to place the local led engagement board. So this board is really now to coordinate and manage the work and to help the spread of COVID, to oversee the local outbreak plan, which you see in your papers, which will also be translated into a very specific action plan, to use those wellbeing principles which we've had presented to the board on numerous occasions using different examples, and really importantly supporting our local communities to really understand the issues. And as I say, there are quite often mixed messages, so we're really trying to ensure we can give some simple key messages. And the Health and Wellbeing Board does provide a forum to ask questions relating to COVID-19. And at the end of the presentation, it's great to see that there have been some questions through our AAPs and from the public that will be answered. And it's really to get that two-way conversation going, which will be really important. And then this board will oversee and will be able to challenge how recovery is planned at a local level, because actually ensuring that we can control the virus and respond to outbreaks is also key in the recovery both of the economy, of our health service, our social care and our communities in relation to recovery. Thanks, Sean. So talked about the Health and Wellbeing Board, and in terms of other governance arrangements, just very kind of quickly to outline what we have working to the Health and Wellbeing Board is the Local Health Protection Assurance Board, and what's really positive is all of the partners around the table are represented at that board, with new partners coming on board as we've been developing the local outbreak control plan. So the university, for example, will be joining us this week. We have additional partners such as the Health and Safety Executive, as well as key members of the kind of work streams, which I'll run through shortly. But I think that is one of the real strengths in County Durham, is having a really strong partnership approach, and that will be really important as we live with COVID over the coming months, and particularly through the winter period. On the right hand side, you can see the kind of internal reporting mechanisms within the council, which includes links to recovery and startup of some of our services, for example, and responsible to the corporate team. And then on the left-hand side of the slide, you'll see links to the Local Resilience Forum, and that's now a strategic recovery group. And Terry chairs that strategic recovery group with key partners. So again, that will ensure that the recovery focus across County Durham and Darlington has input from the Health Protection Assurance Board, and any outbreaks, any concerns we have, any escalation of issues, of cases, can be reported and supported and acted upon through the Local Resilience Forum too. And then there is now a regional oversight group, and again, I think what's really positive for County Durham is that Terry is chairing that regional oversight group, and that has partners including Public Health England, the Director of Adult Services, Director of Children's Services, and as part of that regional oversight group. So we can really think about, okay, if obviously we know that COVID isn't only in County Durham, so it's to ensure if we had outbreaks that are cross boundary, lessons learned from other places. So from Leicester, for example, from very quick turnaround, so that can be shared regionally, and links to kind of key issues of concern such as the testing and such as data. So having strong input to that regional oversight group, I think, is important. Thanks, Sean, because I'll go through the outbreak control teams in a little bit more detail. So the themes in the local outbreak control plan were kind of laid out to us nationally, and we've added to those as we've started to develop our work at a local level. So some of the kind of key themes were around care homes and schools, and obviously there's been a huge amount of work already taken place in relation to outbreaks and within the care home and the care sector. And so at this point, there is slightly different guidance that is now coming through in relation to managing outbreaks in care homes setting. And again, we're working very closely with colleagues within Adult Social Care Commissioning, the NHS, both locally and across the region, to look at those standard procedures for how we'll work with care homes to manage any outbreaks linked to testing arrangements. We also have a theme around schools, working very closely with education colleagues and with our schools. And again, I think it is really important to say that our outbreak control plan is built upon very good established working arrangements with the health protection team at Public Health England. So our schools, if it's a case of meningitis, for example, would know to contact the health protection team. So we've set in place local management arrangements with schools, and obviously testing those with colleagues within schools in relation to any outbreak that may take place. And obviously we'll be testing and balancing and getting ready for schools going back in September. Alongside care homes and schools, obviously we've then got our healthcare settings. Again, colleagues around the board from a healthcare setting will be very well versed and will have existing procedures in place for managing outbreaks of infection, and that's been built upon in relation to COVID. So we've got a dedicated a plan in relation to COVID, and Jill Finlay has been the representative, and obviously Jill's moved to Bradford on a temporary basis, so we're looking to welcome the new Director of Nursing around the table at the local health protection assurance board. We then have obviously high risk places, locations and communities, which is a very long title, but really what we've broken that down to is thinking about our workplaces and our businesses, working really closely with the health community protection team and Business Durham, and our local businesses, so that we know again what procedures we have in place to both prevent and then respond to an outbreak, and then anything in a location. So it's really about building a picture, and we'll come back to data about any cases that may be linked in a particular location. And then we've got a dedicated community group, which is looking at potential of different maybe special interest groups such as faith communities, maybe complex settings such as prisons, or it may also be a geographical location. And again, it's a two-way, so it's working with our communities to identify, but also how we would respond in that situation, building on the work that we've done through the community hub. Local testing capacity is the third theme of the outbreak control plan, and you'll see in the plan that I think from a County Durham perspective, we tried very early to put local arrangements in place through the Foundation Trust to be able to test both NHS staff, County Council staff, and then that was offered out to our care homes. Then obviously we've had a whole range of different national testing programmes, and really at this point it's about enabling us to utilise that testing capacity and to really understand every case that comes through, and to potentially do some further testing where we may have concerns. However, we really do need assurance that the testing capacity and the results of testing will come back to us, particularly from the Pillar 2, as quickly as possible. Because responding in an outbreak situation, you'll all be aware, we need to do that really, really rapidly, and that does remain a bit of a concern. Contact tracing in complex settings, so that may be if there is a particular case in one of our hostels, for example, where it may be more difficult to trace contacts, would be where we would work very closely with Public Health England. So all of these themes we're preparing for currently, and enabling us to respond to an outbreak if it occurs, working with the right people who've got the expertise with working in those settings and drawing on their expertise. Data and integration is the 5th theme of the plan, and again, it's what we've seen. Have seen the local outbreak control plans that we've seen a lot of information in the media about what local authorities have and don't have in terms of data integration, and the data that we are receiving is getting better. However, and we do have an established process with Public Health England for receiving data. We are now receiving weekly postcode data. It's still not quite at the level that would enable us to absolutely know every single case or outbreak that comes through, those test results and where they were based. If it was a workplace, what that workplace was. If it was a school, exactly what the school was. So I think going back to Terry's point earlier, I think that's where it is really important that we continue to raise any concerns that we have nationally. The 6th part of the plan is around vulnerable people, and that's very much if people do have that need to self-isolate, that we're able to offer them the support the way we have throughout the pandemic for our shielded population. And certainly in County Durham, it hasn't just been our shielded population, because obviously using population health management, we've been able to actively reach out to a wider group of people. So if that's been through our primary care networks or through children's services, to ensure that people with multiple vulnerabilities have got the right support in place. And the 7th theme is the boards, and I've obviously outlined the themes of the boards, the governance arrangements that are in place. Thank you, Sean. So the local, in terms of those teams that we've set up, they would all be kind of led initially by Public Health England, and you'll see in the plan those kind of operating procedures that we've now agreed with Public Health England. Some of them are being updated, such as care homes, because there was new guidance produced on the 3rd of July. But we've got a range of settings, we've got some standard operating procedures, and we're developing advice cards and testing those advice cards in different scenarios. So, for example, this morning in the council, we're testing it out with all of our kind of tier 4 managers in relation to their work and what would happen in a workplace situation. I've already mentioned from a school setting with university, healthcare settings, so that we can be as prepared as possible. And right the way through, communications are such a critical element, and also how we engage with our communities. And I'll come back to some of the comms that we've developed so far, and what will be really important for partners to take on board as well. Thank you, Sean. And I suppose at the crux of it, the kind of some of the key messages is through the NHS Test and Trace that was launched on the 28th of May. We went back to testing people. That did go for a few months. From the beginning of March, we stopped detecting cases, whereas we are back now to actually trying to detect cases. So if someone does have symptoms, it's a really clear message for them to start isolating for 7 days and to book a test, which is why it's so important for us to have faith in the testing arrangements and a rapid response from those tests. And what that person will then be asked to do is to share their contacts. And this is where the Test and Trace service comes in. So if they've shared their contacts, and you are a particular contact of someone who has been tested as positive for COVID, you may be contacted, and a risk assessment will be carried out. And if it is clear that you're a close contact of someone who has the symptoms of coronavirus and has been tested as positive, you'll be asked to isolate for 14 days from the time you've had that close contact, because of the incubation period of the virus. And I think these are quite complicated messages, particularly for the public. And you know, when we've been working through them, they are quite complicated messages to get across, and I think it's trying to make them as simple as possible, to really think about if people have got symptoms, to start isolating, to book that test. And also, I suppose, is to try not to become a contact. So constantly thinking about those preventative messages, but knowing that if you are contact by being in close contact with somebody, you will need to self-isolate. And obviously, colleagues and partners are looking at the implications of that for their workforce, and how to ensure that the contacts are kept as low as possible. So moving on to some of those key public health messages. Thank you, Sean. That's great. And interesting, obviously, the stay at home as much as possible. I think that probably just kind of cover it at the moment, because we are getting some slight change in the government messages in relation to home and working from home. But at the moment, it is working from home if you can. Obviously, as restrictions are lifting, more and more of our community are either out working or out. Obviously, now we see pubs and restaurants reopening. We're seeing people socialising more. So the likelihood of an increase in infections is very much there. It is also about the kind of keeping your distance, so 2 meters apart where possible, and if not 1 meter with mitigation. Back to the regular hand washing, in terms of, you know, obviously we've got a lot of health partners around the room and partners in terms of how the virus does transmit. So in relation to that, hand washing for both in terms of surfaces, avoid touching your face, and obviously catching sneezes in your arm and a tissue and binning it. So some of the messages that certainly this board has been saying for a long time, particularly in relation to flu, are the key messages that we really, really do want to get across to our communities, and to retain those messages with our communities, and not to leave home if you or anyone or your household has symptoms, and to access a test. Thanks, Sean. I think it's also really important then to think about our communication, and obviously there's been quite a lot of national communication. What we're trying to do locally is to take that national communication, but really think about it from a preventative point of view, as well as reactive support elements as well. So we've got a range of materials about the symptoms and getting tested, and you know, we've done some insight work, and we know that people are finding those messages confusing, so we've tried to make it as simple as possible. And then what we're doing with each of those local outbreak control teams is have a kind of toolkit for them to use, which will include communication and key messages, both maybe for external communication or social media, websites, etc. And we're really trying to use our emphasis on their demographic targeting. We're really trying to use our intelligence to both target where we will concentrate efforts in relation to prevention or response to outbreaks, and also the intelligence that we get through to then use the communications and engagement with communities in that either particular geographic location or a setting, if it is a school, if it's a workplace, for example. So we're trying to use our communication in a more targeted way. So in terms of the next steps, thank you, Sean. We'll obviously continue to work with the partners. The plan has been drawn together in quite a rapid time scale, and I would like to say thank you to partners for working so closely with us on developing the plan, and most importantly, I think, to be prepared for outbreaks that occur in our area. We are developing a local dashboard so that we can share both with the board and with partners the number of cases, positive cases that we have through, and if we are experiencing any outbreaks in, for example, in a school, in a care home, in a particular workplace, or in a geographical location. And we'll continue to we'll develop that dashboard further and bring that back in more detail to the next board. We will continue that focus on prevention and engagement with our public and our partners to really enable us to have a rapid response to any outbreak. And we'll continue to have that engagement and communication with our residents. And I think really importantly, we will learn from outbreaks. It's usually quite when we have an outbreak, if it's a communicable disease, if it's a foodborne outbreak, we'll tend to have a lessons learned after an outbreak control team, and we'll share those lessons learned. We'll really need to do this rapidly. So as I say, we're already learning from places such as Leicester, and how they've responded to there, and we'll do that in any outbreak situation that we find ourselves in County Durham as well, and we'll adjust our outbreak response accordingly. And certainly the plan that's been presented today will, as I say, be turned into a kind of much more action-focused action plan, along with a toolkit for those key themes. But it really will rely on us all working together as partners, responding as rapidly as possible, and containing and stopping that onward spread. And in that way, hopefully, we'll be able to get people back to some sense of normality. I'm going to stop there, and I'll hand back to Councillor Hovels as chair for obviously any questions before we come back to questions from members of the public.
Thanks, Amanda, for a very detailed plan. Our task today as the Health and Wellbeing Board is to endorse the plan. Can I ask members if they're happy this morning to endorse the recommendation and the plan that's in front of you?
Yes, happy to endorse, Lucy.
Thank you.
Endorse. Yes.
Thank you. We do have some questions from the public, but does any board member wish to ask any questions before? Nobody's indicated, so we'll go straight on. And I'm really pleased that we've got questions from the public. We've always tried to take the Health and Wellbeing Board out to the public, and it's great this morning that we have a number of questions. So the first question I'm going to ask Dr. Stuart Finlay to present the question and the answer, please.
Thank you, Lucy. So just to introduce myself, Dr. Stuart Finlay, Chief Officer from the County Durham CCG and Vice Chair of the Health and Wellbeing Board. The first question has come from the public through the AAP, and the question is, what assurance can the board give to residents with non-COVID-19 related illnesses who are worried about whether or not to book an appointment with their GP? So first of all, I'd like to assure everybody that GP surgeries are extremely safe. The staff are all used to wearing masks in public spaces. They are all socially distancing, not only from patients, but within staff members within their surgeries. They are wearing appropriate PPE when in contact with patients and during consultations. Most surgeries have either set up hot sites in branch surgeries or hot areas within their surgery so that patients with suspected COVID and patients without suspected COVID are separated. Anyone attending a GP surgery will be triaged by telephone by their GP first. All consultations will be by phone or by video call wherever possible. Of the antibody tests that we've done so far on primary care staff, and there have been well over 1,000 staff tested now across County Durham, 9% of our staff have been infected with COVID. That's actually a lower rate than we're seeing in most of our acute trusts. So it does demonstrate that practices have been protecting their staff as best they can from this virus. In addition, we've seen no new cases of COVID for a number of weeks now in primary care. And of course, our worry now is that people are not contacting the GPs with potentially serious illnesses, and we really do need to encourage people to return to their GP with illnesses that could potentially become serious if they are left untreated. In addition to that, GPs are now resuming some of their routine activities, such as cervical screening and shingles vaccine. And of course, really important things such as children's vaccinations, and the children's vaccination programme has not stopped and has continued throughout the pandemic. So I would like to reassure the public that GP surgeries have taken all necessary precautions, and so the risk of contracting COVID in a GP surgery is extremely low. Thank you.
Thank you, Dr. Finlay. I'll move on to the second question, and can I invite Sue Jakes to ask the question and answer for me, please?
Thank you, Chair. I'm Sue Jakes. I'm Chief Executive at County Durham Darlington Foundation Trust. And the question again has come through the AAP from the public. And the question is, what advice can we give residents about whether they need to be tested for COVID-19 before working actively with and within their communities, as some people are worried that if they are asymptomatic, they could spread the virus without knowing it. Clearly, the question particularly focuses and references asymptomatic carriage, but I would ask that anybody in that circumstance was also very vigilant and aware of the signs and symptoms of COVID. And just as a quick reminder, the most common symptoms of coronavirus are the recent onset of a new continuous cough, a high temperature, and loss of or change in normal sense of taste or smell. In terms of testing, anybody with symptoms can get a test. In terms of asymptomatic testing, that is only available to essential workers in England, and there's a list of those on the government website. There are, however, many strategies that are designed to limit transmission within communities, so it's probably worth giving those a mention. The first is to keep your distance from people outside of your household, and a quick reminder, it's already been touched on by Amanda, that the government recommends that you keep 1 metre plus from people as a precaution, and that you try and mitigate that by taking other precautions, which I'll come on to. First of those is avoid being face to face with people if they are outside your household or support bubble, and stay side by side with them rather than facing them. It is really important, and we can't emphasise enough the need to keep your hands and face as clean as possible. You should wash your hands often using soap and water, and ensure that you dry them thoroughly, and where available, use sanitiser outside of your home, particularly as you enter a building or have contact with surfaces, and do try and avoid touching your face. If you're in an indoor place, ensure that it's well ventilated, and keep windows open where that's possible. Avoid crowded spaces. If you can work from home using technology, as we're doing today, to reach out to those community groups, please do so. If you do have to travel, where possible, try and walk or cycle. And if you are having to use public transport, try and avoid peak times. In terms of face coverings, you should wear a face covering in enclosed public spaces where you can't socially distance, and where you will be coming into contact with people that you don't normally meet. Face coverings, however, just to emphasise, do not replace social distancing. So it's to ensure that you do both. I'm sure this won't happen in terms of the group that had asked the questions, but do avoid shouting or singing close to people outside of your household or support bubble, and reduce the number of people that you spend time with in those groupings. Wash your clothes regularly, because the virus can stay on fabrics for a few days. And when you're meeting those community groups in business or public premises, please follow the advice of those premises. All premises will have advice available to you. Thank you.
Thank you, Sue. I'll move on to the next question, and can I ask Jane Robinson to ask this question, please?
Thank you, Chair. Good morning, everybody. I'm Jane Robinson, Corporate Director for Adults and Health at Durham County Council. And the third question has come to us via Health Watch. And the question is, during the COVID-19 response, there's been a reliance upon access to information technology and residents being IT literate or having access to a car for those vital services that local people need, like healthcare and shopping, which has impacted disproportionately on the most disadvantaged. What would the Health and Wellbeing Board's message be to those people who have experienced those challenges? So in response, firstly, I'd like to thank the residents of County Durham for their actions during the pandemic. Our communities have made an absolutely immense contribution to the County Durham Together response that Amanda referenced earlier to support our most vulnerable residents. Additionally, the council made £1.5 million available to support local community groups to provide assistance to residents in need who required help to cope with the impact of COVID on their lives. Of this funding, over £1 million has now been allocated to a plethora of schemes across the county. This is in addition to the critical assistance that over 30 mutual aid groups that spontaneously sprang up across the county have provided, as well, of course, of many acts of kindness provided by friends and neighbours that we've all seen over the last few months. In addition to this, the Hub has been proactively contacting vulnerable individuals to understand their needs and put them in touch with staff or external agencies that could provide the help that they need. Anyone who's rung the Hub with access issues has been supported through a combination of either council staff that have been redeployed, volunteers and the NHS Good Sam volunteers. We've also delivered to people's doors to ensure those requiring to stay at home are able to do so. And our voluntary and community service has been incredibly responsive to supporting people in the local communities, with many undertaking door knocks to those thought potentially more vulnerable. The Hub has also supported a lot of people with IT challenges and guided them through setting, for example, themselves up to priority online shopping. But we do recognise that not everyone is comfortable using technology or has access to it. So we've used a variety of medium to communicate the support that's available within our communities through social media, printed media, radio, or directly addressed mail shots to those that we've known to have multiple social vulnerabilities, as well as our shielded population. And the promotion of the Hub through other existing routes such as pharmacies, primary care, secondary care, housing providers and social care. The support has been put in place quickly to support residents and has been comprehensive and demonstrated the effectiveness of both partnership working and our local communities. Thank you, Chair.
Thank you, Jane. Moving the agenda on, can I ask Councillor Joy Allen, who would read the following question, please?
Thank you, Chair. I'm Councillor Joy Allen. I'm the portfolio holder for Transformation, Culture and Tourism. Social isolation has been a byproduct of the COVID-19 lockdown that has impacted on so many people's mental health. What provision is available to those who need additional mental health or social support?
Thank you, Joy. Can I ask John Pearce to answer the question, please?
Thank you, Chair. I'm John Pearce, Corporate Director for Children and Young People Services with Durham County Council. So in terms of the support we provide for children and young people and their families, we've got a range of resources to support their mental health and emotional well-being. Those resources are targeted at parents and carers, at teachers and other professionals, as well as resources that are specifically designed for children and young people. We recognise it's been a really challenging time for many young people and their families, and for some they may continue to experience difficulties as the restrictions continue to take effect, but also as we move through into the next phase. And for many, the impact of social isolation and the impact on their mental health and well-being may not yet be manifesting itself, so it's really important that we continue to have a service offer going forward, and we're shaping our services in that way. All of our key resources are available on the Council's updated local offer. So the Council website has a dedicated local offer page, and within that page there's a section on social, emotional and mental health support. We've also been working very closely with our schools and looking at how we can support children and young people back into learning, and look at the impact that there will be for many children and young people who will have had a number of months out of school by the time that they return. The guidance around returning safe, happy and settled provides a whole range of information that can be used by children, young people and their parents, but also by schools, by teaching staff and by governors. And that's also available through the local offer and has been circulated out to schools for their use. The information is split down into a range of blocks. So we have a range of activity in terms of guidance and support. We have support in terms of the curriculum and how we can support schools to re-engage children with learning, and also around professional development and support for professional staff and also for governors. In addition, and more broadly, we provide a whole range of support through our family support service and our 1 point centres, which have continued to operate throughout the lockdown period. They provided activities, social support into families, and there's been some really excellent examples of the work that they've done and the impact that that's had for families. The 1 point service are also available to connect families into local community resources, and we know in County Durham we're really lucky to have such a breadth and quality of local community resources available, and the 1 point centre have been able to support children, young people and their families to access those resources, and will continue to do so as we progress into the next phase. Thank you, Chair.
Thank you, John. Can I ask Councillor Gunn to speak, please?
Thank you, Chair. I just want to follow on from John by focusing a little more on children and what's happening in schools. As John mentioned there, it's one of a number of documents that has gone into schools from Durham County Council, is returning to schools safe, happy and settled. And it's been developed within Durham County Council with a particular focus on inclusion, health and well-being. And there's really quite a rich array of information, including sources of advice and help and direct support, and also staff development, because we know that even prior to COVID-19, research had suggested that many children and young people can find transition between schools unsettling and stressful. So following COVID-19, it's more than likely, and we get this information as well from parents themselves, that many children and young people will experience quite similar feelings, if you like, of returning to school after this social isolation. I've actually had emails from parents who have expressed their concern about this. So it's really important that we as a council have done what we have done in putting that information out to schools, because it's important to support our children and young people to experience what we want to be a successful and, if you like, in inverted commas, soft landing back into school. So, of course, this is a process. It's not a single event. And also, we know that it's not something that can be done by one particular area. It's not one agency that can do this. So all agencies have to come together to support children. And as our Chief Executive, Terry, has mentioned earlier, and also the Chair, Councillor Hovels, has mentioned, coming together as a team to support effectively. And they've stressed how effectively we've worked together during this COVID-19, this pandemic. We'll continue to do all we can for our children and young people. Thank you, Chair.
Thank you, Councillor Gunn. It moves the agenda on to item 7, which is any other business. I haven't been notified of any other business, but before I close, can I ask you to before it comes to the end, can I ask you just to bear with us? Can I thank the members for the contribution that you've been able to give today? Can I thank the public and the media who have watched this meeting? And with that, I will move the meeting closed.